Hello, hello. It's time once again for some adventures in aberrant psychology. And today I could tell you about the guy I just watched who had, the cutter scrapes on his wrist, the kind that make it very apparent that you want people to see, that you have attempted, and how he told people that he had a machete and was going to hack his own head off. I can tell you about that. Or the 96-year-old patient who I watched last week who told me when I just went to go get her a soda, she was saying, "I'm sorry to be such a bother. I just can't seem to die." And how no one seems to think of that as suicidal ideation when she says it over and over as her little catchphrase. And when she longs to be with her husband in heaven, and she just can't wait to be with him. No one ever thinks of that as being suicidal ideation because she's 96. She's got paper thin skin that you can see all of her veins, and nobody wants to dare touch her to move her for fear of bruising her. They don't realize that there's a little bit more to it. Or I could tell you about the almost redirectable 88-year-old I watched who had dementia, who, when someone introduces you to someone and they say, "Oh, she's very redirectable," and then they don't tell you that she forgets how you redirected her a minute later, it gets very wearing and tearing on your mind throughout the night, because you tell someone no, you can't get out of bed so many times before you just want to go home yourself. It's depressing and it's taxing on your patience. Same patient filled her diaper underneath her covers at 5:30 in the morning and decided to pick at it underneath the covers so that before I could see exactly how bad it was already a mess. And all I could do was push the nurse call button and hold her wrists gently and just wait for it all to go away, but the wafts, ugh. It's like changing a baby, an 88-year-old baby. I can tell you about all of these things, but what I really want to talk to you guys about today is relapse. Because, I work with a lot of addicts and drunks. Okay, we're just going to say that drunks fit under addicts for the purposes of this video, okay? They're all the same. Addicts. So, I work with these people, and nurses, and the family of patients, and sometimes other patients will tell me that they can't imagine working with addicts even half of the time, because they're so hard to deal with, and everyone's got an addict in their family somewhere that they don't want to see, but it's as if people regard addicts especially as a special class of people who they're there because it's their own fault. And it's very hard to not think of addiction as something that is the addict's fault, because they're the one who started using the substance. They're the ones who continue to choose to use the substance. Well, once you start to become educated on the subject of addiction, you realize that, it's a disease that affects your decision-making processes, and sometimes there are other incentives as well that will keep people using, such as aversion to pain for heroin addicts. When people who are addicted to alcohol get to the point where they have delirium tremens and worse, they need a drink or some other form of medical assistance to get off of alcohol, because without medical assistance, they're not going to achieve a clean, sober life. There is a point where it's not just a choice anymore. And I see that a lot in the emergency room. Now, the thing that sets addiction apart from other, let's say, less hated diseases, okay, diseases with less stigma attached to them. The thing that sets addiction apart is that people view addictions as being an immoral thing, and it's a wicked thing that people do. It's selfish. They're selfishly choosing to hurt themselves. And if someone goes into treatment, they come into my ER, and then they get placed in a treatment facility, right? And then they leave that treatment facility, and they're good for, say, 2 months, and then they relapse, and they start taking whatever substance it is. Their friends, their family, the neighbors, everyone looking at this person will say, well, that treatment didn't do anything. It didn't work. Many times they'll blame the treatment, but more often they blame the person for not following what the treatment said, but then also thinking, addiction treatment is just, it's ineffective, it's a waste of time, it's, something that is just, I don't know, pissing in the wind. If somebody doesn't really want to change, you can't change them, so, when you give treatment to an addict, it's just pointless. That's the way people think about it, and it's not true. But what I think is lacking is an idea that relapse as a cycle, relapse happenings every so often, someone falling off the wagon, it's actually part of an expectable treatment. Like you can make some guesstimations on how long someone's going to last without relapsing, and you can say on average people will last a couple of months, they'll need another little burst of treatment for a little reframe, and then they can go back out, and after a couple of relapses they will finally be okay. Hardly anyone goes into a drug treatment center and comes out and is able to maintain their sobriety perfectly, And some of their relapses they are able to arrest right away and handle it on their own, but some of them get out of control and they have to go back into treatment. Now, drug treatment programs are known for having relapses happen after them. There's this stigma about it, like people just think that it's an ineffective thing, but the actual relapse rate for drug treatment programs is anywhere between 40 and 60%. So at least 40 to 60% of people are not relapsing after leaving treatment. It's amazing. People think that it's somewhere like 99% of people will just go right back to drugs. That's the feeling that they have. But it's not the case. And what's worse is there are other comparable diseases to addiction that have higher relapse rates, but people never think about the treatment as being something that was ineffective. You know, such as, let's say, asthma. Okay? Someone has asthma. It's not just about, giving themselves breather treatment every day or when they feel symptoms coming on. It's about avoiding situations that will give them an asthma attack. But every so often in my emergency department, you will see somebody who is there for an asthma attack. What brought it on, you ask? Well, how about a 16-year-old who has had asthma all his life and gone to respiratory therapy all of his life, then all of a sudden decides to try his hand at track and field and decides to try to run 5 miles. I'm not going to go with fat people and weight loss because I do see that as another addiction. But there are other things that are similar diseases to addiction. Like, say, hypertension. Right? Someone has hypertension, they're given blood pressure medication that they should take if the doctor prescribes it to them. And they're told to lay off the steak, And when they don't, and they end up in the ER with, heart palpitations and, what's wrong? Am I having a heart attack? Or they have a stroke or whatnot. Do people say, oh, that class that they had to take as part of their therapy, when the doctor taught them to stay away from steak and gave them that medication that they should have taken every day, but they didn't. That was ineffective. No, they don't say that was ineffective. They say, hey, he should have stuck to the plan, and it's hard because you can't live life very well. You can't enjoy your life if things are taken away from you that you love, like steak. And there are many different diseases where people think that they're okay, and they forget to take their medication for a while. Such as depression, which also has a very comparable relapse rate. People get told, here's your medication for your depression, take it daily, and stay away from situations which are going to depress you. They get given classes on how to manage their stress. Do they manage it well? No. Do they take their medication? No. They end up in the ER for suicidal ideation or just come in saying depression, and they have a relapse, okay? The relapse for depression, in general, is way worse than addiction. It's somewhere like 80% of people who get treated for depression will end up going back into an urgent care or emergency care situation after they are treated, But nobody ever thinks, oh, that depression care, that depression medication, that was ineffective, There's no huge stigma about that. It's just seen as, oh, this is something that happens. Sometimes, people forget to take their medication, or sometimes bad things happen in life that you can't control and it's going to set you off. They never put that blame on the therapy and the patient like they do addiction. And so, in looking at all of these things, like type 1 diabetes, you know how many times I've seen someone who has this medical condition where they've been taught, check your blood sugar, take your insulin, and don't eat candy. You know how many times I see them in the ER? A lot. The relapse rate for people who caused their own diabetes through eating candy, and then they get taught not to eat candy, and then they still do it, it's huge. Just as huge as addiction to alcohol or heroin or meth, people will show back up in the ED for diabetes. And it is relapse. They fell back into that condition that creates that emergency situation. That is a relapse. So, when people ask me, how is it that I can work with someone who I know is likely to just relapse and forget everything, and just end up right back in that same situation, I just don't see it the same way, because one, I know the actual numbers don't bear out what they're feeling. It only takes a relapse or two in your friends or family before people really start to hold that same grudge that the rest of society does against addiction therapy and addicts. And part of that is a moral component, but people just don't see the numbers that I see. They don't understand that relapse is a part of treatment. It's predictable. It's going to happen in a certain percentage of people. And after that relapse, take the same people, put them through treatment. Some of them will relapse again and some of them won't. But after enough cycles, you get to a point where therapy really is effective. No matter what the condition is, it's a far cry better than nothing and cutting people off from treatment because of whatever stigma you've placed on it. So, yeah, I wish people would encourage more treatment for all sorts of illnesses, but especially addiction, because that sort of stigma being passed from person to person doesn't help people who are maybe interested in that field. What's funny is I've worked alongside other people who have psych majors, and I've heard them say things like, I would never want to limit my practice to just like addicts and people who have drug problems and stuff. I want to work with, real mental disorders. Not realizing that, substances create mental disorders. Substance abuse can be a co-occurring disorder with mental issues, that people will treat their own mental issues with substances. They will self-medicate, not realizing that the huge majority of work in psychology deals with people who have had substance abuse problems, either right now or in the past. And the huge amount of problems that need to be addressed by therapy for people who have an addict in their family who aren't addicted maybe, but it caused their stress. And those are dreamers. The dreamers who think that they can practice in therapy or in psychology or as a social worker and avoid addiction. It's there. It's pervasive. It's everywhere. And treating it as though it's something that you can avoid like the plague is not helping